Depression, although defined as a devastating disease, is defined by the Merriam-Webster Dictionary as a psychoneurotic or psychotic disorder, marked especially by sadness, inactivity, difficulty of thinking and concentration, a significant increase or decrease in appetite or loss of sleep, feelings of rejection, hopelessness, and sometimes suicidal tendencies. What I'm about to tell you is based on medical research, written documentation, and other findings from published authors and renowned doctors to support the argument that antidepressants is damaging and that alternative solutions should be taken. I intend to assess the damage of antidepressants and inform the audience of other options for the treatment of depression, while presenting each individual a profound knowledge to move forward in a light of alternative solutions. I hope to decrease the distribution of antidepressants and increase the usage of alternative solutions and cures for depression. As a patient diagnosed with severe depression, I feel that my knowledge on the topic provides me with the credibility and also gives me personal experience as a patient who struggles with depression and overcoming the battle of sadness. There are many alternative choices and solutions for the relief of depression. I would like to be the first to tell you about them. I'm here to give you relief that you could soon be feeling and providing for others. Doctors need to put down their prescription pads, and patients need to listen carefully, because I'm here to explain to you the shortfall of antidepressants and the joyous news of alternative hope and freedom from depression. What began as a genuine intent for doctors to help their patients with their impending doom and false sense of hopelessness has grown to a widespread epidemic that has resulted in troublesome outcomes due to the overuse of antidepressant prescriptions instead of the use of other alternative solutions. Too many people are prescribed antidepressant medication that have been gaining attention for its recent discovery and long-term effects by those who have been using them. Depression is defined using various terminology of impending doom, with symptoms from nail biting to weight gain, according to Kramer in 1993's book, Listening to Prozac. Not only are doctors unable to pinpoint the true meaning of depression, but many individuals have problems conveying the difference between being chronically depressed and being unable to shake off the feeling of gloom brought on by extenuating circumstances. Due to the confusion oriented with the diagnosis of depression and the inability to test depression based on any kind of treatment or shot or testing, depression is hard to catch. It is not a state of being. It is not a mood swing or a sudden case of the blues. Although many have mistaken depression for prolonged sadness, it is a disease associated with chemical imbalancement of the hormones. Such symptoms include feeling low and drained, sense of worthlessness, change in facial figures, loss of muscle tone, slow speech, delayed reaction time, hallucinations, loss of sleep, thoughts of suicide and violence, excessive worrying, change in sex drive, inability to concentrate, depletion of vitality, and loss of self-image and self-esteem. Research has supported that depression alone costs more than $44 billion in the United States economy each year. The impact on society includes decreased economic productivity because of the days at work lost due to the illness, as well as increased health costs, according to DePaulo in a 2002 article that he wrote. This is why it's important to understand depression and treat it accordingly. Antidepressants are also known as selective serotonin reuptake inhibitors. They increase the release of serotonin in the body, which deals with the communication. It's a neurotransmitter that deals with the communication within every aspect of the body. With the increase of serotonin, there is a decrease in dopamine, which is a feel-good hormone. This negative correlation is very ironic depending on what it is that these pills need to do to cure depression. In summary, antidepressants are stimulants for those who have otherwise be caught up in the downward spiral of impending suffering from the loss of vitality. Upon initial beginning of such medication as antidepressants, Curtis in 2001 had stated in his book that you become jittery or feel the sensation of being caffeinated. This immediate feeling generally wears off after 2 weeks, and in some cases after a few hours, depending on the various medications that you take. Antidepressants are a mood-altering medication that has been come to, although make people feel as if they're losing the fuzziness around the edge as everything goes on, according to Dr. Glenn Mullen in 2002. We also learned that It seems to end obsessive and running thoughts, according to Dr. Dworkin in 2006. Antidepressants limit such negative thoughts by boosting energy, allowing patients to have a newly found self-motivation. SSRI medication works the same way as cocaine and amphetamines, yet they're legal substances that many prefer for a rainy day. Their increase and their direct effect of increased energy is the negative effect that many people need to realize. Despite all the positive hope associated with antidepressants and how they work, only a small percentage of patients respond accordingly. Patients' results vary on a wide scale of responsiveness. Short-term effects may be encouraging to some, however the likelihood of these short-term effects are slim, with a large percentage of an opposite reaction of long-term and others' effects diminish in value. Antidepressants present a negative opportunity for bodily harm and mental stamina. There's a strong and present risk associated with these antidepressants and drug damage. Their short-term side effects include nausea, dizziness, floating sensation, agitation, headaches, dry mouth, sleep disruption, constipation, blurred vision, sexual dysfunction, weight change, memory loss, and sedation, according to Dr. DiPaolo in a 2002 study that he conducted. However, many of these short-term side effects have grown into long-term lasting effects, and these lasting effects carried over, but these side effects carried over, but other effects that have come prevalent as humans learn from trial and error how to treat the function from depression. The misfiring of neurotransmitter is resulting in disorganized, chaotic activity in the voluntary motor system and loss of motor skills. People are gaining the tics, neurologically generated agitation, drug-induced Parkinson's, and muscle spasm. Such damage could be compounded in the future by other medications, viruses, and toxins, which injure the involuntary brain system. With all the negative withdrawal symptoms that are shown, there has been estimated to affect 50% of the patients depending on the particular drug, according to Dr. Glomlin. In an article on withdrawal symptoms with the Prozac group of medication in July 2007, Journal of Clinical Psychiatry, Dr. Zahn Dziedzica reported that the agitation and irritability can cause aggressiveness and suicidal impulsivity. There's too many negative side effects to let all the positive go unanswered for. That's why there's alternative solutions that we all need to take into effect. Such alternative solutions include therapy, change in work and sleep habits, becoming aware of the effect of caffeine, a proper diet, alcohol, and the role it plays on depression, exercise, relaxing techniques, and their personal lifestyle changes. There's cognitive therapy, group therapy, and couples therapy that all can be used according to one's needs and problems. Also, change in work and sleep patterns lead to a stable lifestyle with sufficient rest and energy for the day. Change in caffeine uptake and alcohol and a change in diet can also lead to feelings of relief and cure the chemical imbalancement within one's individual's body. As stated before, alternative means to overcoming depression is exercise as well. Exercise increases mood, elevates energy, and releases dopamine, the feel-good mode. Exercise is considered to be the best natural antidote to depression, according to Dr. Glenn Mullen. There's also stress management and relaxation techniques such as relaxation tapes, breathing exercises, meditation, biofeedback, just to name a few of them. With the success of these techniques, individuals can overcome an abundant amount of emotions associated to depression. Making a decision for personal change is essential in overcoming depression and overcoming the urge for medication. Be positive, be strong, and stay focused on the goal at hand. Depression can be managed and overcome. With the use of positive thinking and alternative solutions, success is within your reach. Freedom from depression is near. So as I said, antidepressants are detrimental to the effect of bodies and humans. Impending doom is not relieved by medication, but by the alternative solutions. The growing results of short and long-term effects by the usage of antidepressants need to be taken into consideration and made aware. Make us change and work on the use of alternative medicine instead of antidepressants.